Hello and welcome. Today we're going to be diving into the world of congenital heart defects. Now, I know it can sound like a really complex topic, but I promise we're going to break it down so it all makes perfect sense. We'll look at what they are, how they work, and importantly, how they're managed. Right, let's jump straight in.
So let's start with the big question, shall we? The heart is just this incredible, intricate bit of biological engineering. But what happens when, during its construction, in the womb, something doesn't quite form as it should? This is really the question at the core of everything we're about to discuss.
And here we have it, the official definition. Congenital heart disease, or CHD for short, is really any kind of abnormality in the heart's structure or its function that is there from the moment of birth. But, and this is a really important point, present at birth isn't the same as found at birth. Some of these defects can actually go completely unnoticed for months, or in some cases, even years.
Now, this is what I find absolutely fascinating. For the vast majority of cases, a whopping 80%, we just don't know the precise cause. It's what doctors call multifactorial, a sort of complex mix of genetics and maybe some environmental factors. It's only in about 20% of cases that we can point to a specific known reason, like a particular genetic condition or an illness the mother had during pregnancy.
So, here's a quick look at where we're headed. We'll talk about how these defects are categorized, which is super important. Then, we'll dive into the most common holes in the heart. After that, we'll explore something called a PDA, which is a leftover from our time in the womb. And finally, we'll wrap up with how we find and fix these issues today.
Right, this is probably the most important concept to get your head around. To really understand congenital heart defects, you need to know about the two main groups they're split into, cyanotic and acyanotic. Getting this distinction is pretty much the key to unlocking everything else.
And this image lays it all out beautifully. You've got the cyanotic defects on one side and the acyanotic ones on the other. As you can probably tell just by looking at the list, the acyanotic defects are generally a lot more common, and they're the ones we're really going to focus on today.
So what's the actual difference then? Well, acyanotic literally means without blue. In these conditions, you get a leak or a shunt of oxygen-rich red blood from the left side of the heart over to the right. This means way too much blood gets pumped to the lungs, but it doesn't cause that bluish tint to the skin. Cyanotic defects, on the other hand, are the opposite. The plumbing's gone wrong in such a way that deoxygenated blue blood gets mixed in with the red blood that's heading to the body. So the body gets blood that's lower in oxygen, and that can cause the characteristic blue color.
Okay, so let's get into the nitty-gritty of those acyanotic left-to-right shunts. You've probably heard people talk about a hole in the heart before, and that's often what these are. We're going to start with the most common one of them all. Just have a look at that number. 20%, this one single condition, the ventricular septal defect, or VSD, accounts for a full 1/5 of all congenital heart defects. That is a staggering number, making it by far the most common type.
This picture shows exactly what we're talking about. A VSD is a hole in the wall, the septum, that divides the heart's two main pumping chambers, the ventricles. Now, because the pressure on the left side is so much higher, oxygenated blood gets squeezed through that hole over to the right side, and all that extra blood, it gets sent straight to the lungs, which really aren't built to handle that kind of pressure or volume.
But, and this is a big but, not all VSDs are the same. The size of that hole changes absolutely everything. A small VSD often causes no symptoms whatsoever, and incredibly, about half of them will just close up on their own. Now here's the weird part. They cause a really loud, harsh heart murmur. Think of it like water being forced through a tiny crack. A large VSD, however, is much more serious and can lead to things like heart failure. And because there's less resistance through a big opening, the murmur is actually quieter. It's a classic medical paradox. The louder noise is actually the better news.
This brings us to the most serious thing that can happen if a large defect is left untreated. If that high-pressure flood of blood to the lungs goes on for too long, it can cause permanent damage, resulting in a condition called Eisenmenger syndrome. This is the outcome that modern medicine works incredibly hard to prevent.
So how on earth does that happen? Well, it starts with that big left-to-right shunt just overwhelming the lungs. Over time, the blood vessels in the lungs start to thicken up to protect themselves, which makes them stiff and narrow. This is called pulmonary hypertension. Eventually, the pressure on the right side of the heart gets so high that it becomes even higher than the left side. At that point, the whole system flips. The shunt reverses, and now blue, deoxygenated blood starts flowing to the body, causing cyanosis. And once that happens, the damage is sadly irreversible, which is exactly why fixing large VSDs early is so critical.
Right, let's move upstairs in the heart, shall we? The second most common type of hole in the heart is the atrial septal defect, or ASD, and, as you might guess from the name, this is a hole in the wall between the two top chambers, the atria.
So ASDs make up about 10% of all congenital heart defects, and for some reason, they're much more common in girls. The really interesting thing is that most children with an ASD have absolutely no symptoms. It often gets picked up by pure chance when a doctor is listening to the chest and hears a very specific, unique heart sound. And just like with VSDs, size matters. If the defect is smaller than about 8 millimeters, there's a good chance it'll close on its own. Any bigger than that, and it's almost certainly going to need some help to close.
Our final example is a really cool one. It's less about a mistake in how the heart was built and more about a bit of leftover plumbing from when we were in the womb that just forgot to close down. It's called the patent ductus arteriosus, or PDA.
So before we're born, we're not using our lungs to breathe, right? So the circulatory system has this brilliant little bypass channel called the ductus arteriosus. You can see it right there on the diagram. It connects the main lung artery directly to the aorta. This lets blood pretty much skip the lungs and go straight out to the body, which is exactly what a fetus needs. But what's supposed to happen is that after a baby is born and takes its first breath, this channel closes down within a few hours or a couple of days. A patent ductus arteriosus simply means it has stayed open. It's a perfectly normal bit of our fetal anatomy that's just outstayed its welcome. And this just brilliantly illustrates the modern solution to the problem. What used to be a big deal can now often be sorted out without any need for open heart surgery. Doctors can thread a tiny little device, just like the one you see here, up through a vein in the leg, all the way into the heart, and then deploy it to just plug the hole. It's an incredibly clever and elegant fix.
And that leads us nicely into our final section. We've talked about what can go wrong, but how did doctors actually find these faults, and what are the modern ways of fixing them?
Well, the toolkit for diagnosis is really quite something. An ECG can check the heart's electrical rhythm to see if any of the chambers are under strain. A chest X-ray gives a great overview of the heart's size and shows if there's too much blood flow to the lungs. But the real game changer, the gold standard, is the echocardiogram, or echo. It's basically an ultrasound that gives a detailed, moving picture of the heart, letting doctors see the defect, measure it precisely, and even watch the blood flowing through it in real time.
And once the diagnosis is clear, there's a whole range of treatment options. For some people, simply managing symptoms with medication is the right path. For many of these holes, like the ASDs and PDAs we talked about, that non-surgical catheter closure is the way to go. And of course, for defects that are just too big or complex for a device, open heart surgery is still an amazingly effective way to repair the heart for good.
And that really brings our story full circle. When you step back and think about it, the journey from a doctor hearing a tiny, subtle murmur to an ultrasound pinpointing the exact problem, and then to a tiny device fixing a hole that's been there since before birth. Well, it's just incredible, isn't it? It's a real testament to how far we've come in understanding and repairing the very first beats of a human heart. Thanks so much for joining me.